Your Health, where we explore the latest in health across the country. I'm Erica Cardenas. We're here at the Scottsdale Center for the Performing Arts and Center Space Gallery to explore an incredible art program. But before we get started, let's take a look at what's coming up on the show. The difference rehab can make for those with pulmonary disease, and how poison control is helping the community. Plus, a healthy recipe for Thanksgiving. All that and more coming up on Your Health. We're here at the Scottsdale Center for the Performing Arts to talk about the Memory Lounge workshops, and joining me now is Natalie Marsh, Director of Innovation and Learning, to tell us more. Thanks so much for being with us, Natalie.
Well, thanks for coming.
Tell us about the Memory Lounge workshops.
Sure, so Memory Lounge is a program that we have designed for people with mild to moderate dementia and their care partners. So they come here twice a month on the first and third Fridays for 90 minutes, where they get to participate in all sorts of fun, hands-on workshops, activities, and get a tour of the Scottsdale Museum of Contemporary Art.
Tell us a little bit more about the types of activities that participants engage in.
So Scottsdale Arts is a multidisciplinary arts organization. We're not just visual arts. So we do everything from painting, drawing, fiber, but also music, drumming, and even improv.
So Natalie, who are the workshops geared towards?
So the workshops are designed for people living with mild to moderate dementia. So we know that we tailor the workshops to be simple, fun, casual, but they're also designed for care partners, because we know that this disease, when someone is diagnosed with Alzheimer's or another dementia-related illness, it can be isolating and lonely for not only them, but also their care partners. So we make sure it's a couples workshop where they can come together, work together, make new memories together.
Now, Natalie, why did you feel there was a need to create these workshops?
Well, interestingly, the largest population growing in Arizona is those over the age of 65. And we know as we get older, unfortunately, our cognitive abilities decline. We also know that when someone, again, diagnosed with Alzheimer's or dementia, their care partner becomes extremely isolated. And actually, the statistics for care partners is huge. They suffer from depression, they don't take care of themselves because they're always giving their care and love to another person. So we really wanted to give a space where people could come together, have a memory that's not in a doctor's office, and a chance for them to get together not only with their partner, but also with others that are going through similar situations like them.
Now let's talk a little bit about impact. What type of impact have you seen in participants who take these workshops?
So we love evaluation in our department. It's really important for us to make sure that we're designing programs that do have a deep impact. So we, at the end of every program, we say, how are we feeling today, a scale of 1 to 5? And I have to say 99% of it, it's always a 5. I have this one great story I remember from a participant who, after she left, she said, you know, I haven't laughed so hard. It was so fun to forget about forgetting today.
Now, it's National Alzheimer's Disease Awareness Month, so why is it so important for those who are dealing with memory issues to be engaged in the arts?
Well, first of all, don't wait until you are diagnosed with something or a loved one is diagnosed with something. Brain health is crucial when you work in the arts. Listen to music, create a painting, go to a museum, keep your brain active at all phases of life, but also we know that those that participate in arts experiences have a better quality of life, meaning their social life, their mental wellness, all of those things are improved through these experiences. We know the art won't cure the disease, but at the very least we can make the quality of life for caregivers and care receivers to be the best it can be.
Now, Natalie, how can people sign up for these workshops?
Well, you can Google Memory Lounge, and we're actually one of the first hits you can find, but you can also go to scottsdaleartslearning.org and find that workshop.
Are there other types of art programs like these around the country that people can participate in?
The best place to start looking is probably the AARP website has a lot of memory programs, as well as the Alzheimer's Association has a number of places you can look. Surprisingly, people don't go to their museum to find resources when they are diagnosed this way, but also do check out your museums, your performing arts centers, your local arts community programs, because I know we worked in Arizona with a large cohort across the state, and many of them are still offering these kinds of programs today.
Natalie, thank you so much for this valuable information. If you'd like to learn more about these programs, just head over to the website. Healthcare open enrollment is here, and the experts at Palomar Health Medical Group explain the importance of selecting the right physician for you.
The importance of open enrollment cannot be overstated. This is the time of year when you can select a new plan or a new physician. And this can impact your care for the coming year because it depends which network you're in and which specialists you can see. If you already have specialists that you see for certain medical conditions, you want to make sure that you have picked a network that has those specialists in it or another comparable specialist. Navigating specialty referrals can be a complicated thing. It's very important to use your primary care physician as the quarterback for your medical care to assist with all of these types of referrals. When I refer a patient for a specialty need, I will communicate with that specialist, letting them know the reason that I'd like the patient to be seen and expect communication back from them as well. We want to be there to help you to get to see the doctors that you need to see. There are lots of great things happening in medicine right now. We have some newer medications which are really good for diabetes and also for weight loss. There's also personalized medicine, which is really cutting edge, but looking at people's genetic makeup to see what best suits them for treatments. Telemedicine isn't really new, but that is something that we are able to provide in many locations so that you don't always have to go into the doctor to get treatment for simple things. Also, immunotherapy for cancer is a new treatment that allows for targeted treatment for certain types of cancer like melanoma and some lung cancers. Another thing I'm excited about is the advancement of scribe technology for physicians. This allows an ambient scribe to record an office visit and help the doctor create a note. This allows them to look at the computer less, look at the patient more, and also allows them to spend less time on the computer after hours. There are also some new advances within the electronic health record where the computer system can summarize what's happened since the patient was last seen. These are things that I think are going to revolutionize the practice of medicine. It's important to find diseases early so that we can have excellent outcomes and hopefully not have any ongoing problems with your health. At Palomar Health Medical Group, we have 300 physicians who are ready to serve you. We have multiple primary care doctors all over the county, especially North County, even up into Temecula and Murrieta. We have many specialties, almost every specialty available. And the best thing about being part of a group like PHMG is that our physicians talk to each other. We have easy access to each other through the computer, through our EHR, and through Microsoft Teams. So it's always easy to get a hold of each other and make sure that your specialists are talking to your primary care doctors.
Here's a sobering fact: more than 6 million Americans are currently living with Alzheimer's, and by the end of 2050, that number is projected to rise to nearly 13 million. Evidence is strong that you can reduce your risk by being physically active and maintaining good heart health. Stick around, here's what's coming up on your health. Better health with the assistance of pulmonary rehab and getting the desired look you want at La Jolla Cosmetics. Pulmonary disease can cause severe issues with a patient's overall health, but with pulmonary rehab, these patients can be helped immensely.
When I see a new patient who I suspect has chronic obstructive pulmonary disease or COPD, one of the first thoughts I have is that they need to go to pulmonary rehabilitation. It's the cornerstone of effective therapy for patients with COPD because it prevents worsening exercise intolerance, prevents hospitalizations and exacerbations, and trains patients how to deal with their own disease process so they can manage their medications and their therapies more effectively.
Pulmonary rehab can be a wonderful extension of the medical services to patients with COPD, including weekly reports to the physician about the patient's progress. On top of the pharmaceutical intervention and medications that we provide, the most important part of the treatment is referring these patients to pulmonary rehab. Any physician can initiate that process and refer the patient to pulmonary rehab, as we know that will help sometimes even more than pharmaceutical intervention.
When the patient gets admitted for COPD exacerbation and recover from that hospitalization, it is important to break that cycle. First thing for a physician is to make sure they're on the appropriate medications. Another important intervention is to recognize these patients and refer them to pulmonary rehabilitation program. My experience with patients who receive pulmonary rehab is quite positive. When I refer these patients, they come back to me saying that they have improved symptoms, they have improved functional capacities, a lot higher level of endurance. They feel great about it. Their attitude towards life is a lot better.
Psychologically and physically has been amazing improvement among all my patients, and I see it every day, and I highly recommend that.
When a patient's on oxygen therapy, you have to remember that oxygen is a drug with a dose that needs to be adjusted depending on the patient's circumstances and disease progression. The dose can be adjusted in the doctor's office, but can also be effectively monitored in a pulmonary rehabilitation setting where the patients are exercising and can be checked frequently and see if their dose has to be increased or decreased. One of the community resources that has been very effective over the years is the Better Breathers Club that's sponsored by the American Lung Association. It's currently being hosted by La Mesa Rehab in their facility, and it can be a very pleasant experience for patients to socialize and become educated about their disease process. If a patient has been diagnosed with COPD and is still having shortness of breath, they need to speak to their doctor about having their medications adjusted and to be referred for pulmonary rehabilitation, which will improve their exercise capacity and improve their quality of life.
La Jolla Cosmetic prides itself as a place where dreams become real and they can help you create the look you desire. Let's see how they achieve this.
See, I was born in Poland, originally came to the United States when I was 11 and trained most of my life in Chicago. My undergrad was actually in visual arts, and I think medicine kind of became near and dear to my heart, but always wanted to find a way to combine medicine with art, and I think where I am today kind of marries those fields very well. I finished a general surgery residency back in Chicago, and then I went on to train in plastic surgery at University of Utah, and after that I did 1 year aesthetic plastic surgery fellowship in Beverly Hills. Part of my time in training actually happened in San Diego, and ever since we left San Diego, every single place that we lived in outside of San Diego never compared. So one of our incentives was to really come back to San Diego. Well, between the 3 kids, I think that keeps us pretty busy, especially the 15-year-old now that he is growing up and getting a driver's license. One of my personal passions is cars and driving, and he is definitely on board with that as well. So I'm proud to say I taught him how to drive a stick shift before he ever got a driver's license. He will get his license on a stick shift, and we kind of share that passion, so that makes it easy. So the Brazilian butt lift is a very popular procedure around the world, and it basically involves shifting fat around in any given person. So we liposuction a problem area that a patient has, and we take the fat and we transfer it over to an area that they want to curve out a little bit more. One of the trends I noticed when I was working in Beverly Hills is that I want a BBL, but I don't want a big butt. So what we did as a community of plastic surgeons, we sort of trended towards this new concept of a skinny BBL, which applies to any given patient that is actually very well fit, but there are certain problem areas on their body that they just cannot control in the gym. So we definitely have technology to try to visualize what the result may look like. One of the technologies that we use is Vectra. We have that in the office, and what that does is it takes a scan of the patient's entire body in 3 dimensions. Digitally we can shave away the fat areas and potentially augment the flatter areas. And it's really a tool of communication for me and the patient, and gets us on the same page, and I think the results are better because of that. I think people like my results because I really take the time. I think my procedures do take a little bit longer, but I get to be a lot more precise. I get to use smaller cannulas. I get to use all these techniques that I think are very important in order to give them not just that immediate result, but that lifelong result in a smooth contour. I think that takes time, it takes precision, but it's worth it. So I was happy to find out that my satisfaction rate for this procedure was 98%, or 4.9 stars, I think I saw somewhere. And I think it comes from the fact that I really do take the time and be very precise about the procedure and again focus on that long-term result as opposed to just the immediate result for the patients.
If you're suffering from memory issues, talk to your doctor. Effective communication is important when seeking a diagnosis for memory loss. Be prepared to ask questions and be honest about your situation. You can go to the Alzheimer's Association website for a guide on how to prepare for your doctor's visit. Here's what's coming up on Your Health. We take a look inside the world's largest poison control system and a delicious and healthy Thanksgiving recipe. The largest poison control system in the world is located in California, and they're prepared to handle any type of situation that may come up. Let's take a look.
Poison control.
In California, we have a licensed and designated poison control center called the California Poison Control System.
Okay, and how many minutes ago did this happen?
It's the largest poison control system in the world and takes care of probably 6 to 10% of the population of the United States.
We're one of 4 divisions that comprise the California Poison Control System, which was brought to fruition in 1997.
Okay, and how many teaspoons or mouthfuls did she drink?
If you call the poison control system, you'll get either a pharmacist or a nurse, and sometimes even a doctor. And if you call from a health care facility, you are always able to talk to a physician who's a medical toxicologist. Methamphetamine is a dangerous drug. It's probably the most commonly abused street drug, especially in California and certainly in Southern California. A lot of times a lot cheaper than alcohol. Methamphetamine affects every organ in the body. After it's used for a long period of time, people can get damage to their brains, and that can lead people to get depressed and have personality changes. It's fairly well known that they have bad dentition and their teeth can fall out. They can get damage to their heart and heart valves and develop things that look like heart failure if used over long periods of time. It's estimated that almost 20% of people have used marijuana in the last 30 days in the state of California. That can leave a lot of marijuana products in households where there's children. Most of the dispensaries in California that sell marijuana products will sell them in child-proof containers. These child-proof containers work pretty well, and most kids can't get into them who are younger, like 2 years of age. However, if the top is left off, or if products like a gummy is left on a table, then it's easy for children to get into them and possibly be exposed to marijuana products. In very severe cases where they ingest a lot of the product, several different gummies, we've seen people have convulsions before and extremely bizarre behavior for several days afterwards. Another toxin that we are commonly exposed to in Southern California are stingrays. Our beaches in the summertime are lined with people who get stung by stingrays. Stingrays don't bite, they have a barb that's on their tail. And that venom gets injected into the skin or the foot, and it's severe pain that people say they've never felt before. The venom that's contained within a stingray barb is what we call heat labile. That means that if you subject it to high temperatures, the venom actually denatures or falls apart. We don't want to burn the extremity, but we want to put it in as hot as tolerated water at the time without a burn being caused and leave it there until the pain starts to get better. The number to contact the Poison Control Center in California is 1-800-222-1222.
Don't go away, we have more Your Health coming up from Scottsdale Center for the Performing Arts. Whether you call it stuffing or dressing, we have a healthy version for your Thanksgiving. With the holidays fast approaching, it's a tale as old as time. The good old stuffing versus dressing conversation. And despite having different names, there really isn't a whole lot of difference between the two, each being made with a stock, onions, and some sort of a bread base. So what is the difference then? between stuffing and dressing? Well, in the most technical term, stuffing is stuffed inside of a cavity of a turkey and cooked there, whereas dressing is cooked in a separate vessel, such as a casserole dish. And the name game usually splits along regional lines, so depending on what part of the country you live in, you might prefer the word dressing to stuffing. I myself was raised using the word stuffing and still use the word stuffing. So today I am going to show you how to whip up a quick, easy, healthy, and oil-free stuffing. Your ingredients consist of 1 to 2 cups of a stock. I myself am using a vegetable broth, 4 stalks of celery, 2 carrots, 1 onion, 3 cloves garlic, and about 10 cups of bread. You can either use a whole grain bread or a multi-grain bread, works well. And your dried herbs, half a teaspoon of rosemary and 1 teaspoon of parsley. Once you've chopped up your vegetables, you're gonna go ahead and saute them over medium-high heat for about 7 to 8 minutes. Then you're gonna cube up your bread and stick it in the oven to toast it for a little bit. You don't want it to become too rock solid, hard like a crouton, but you do want it to have a little toast, a little crunchiness to it. Now my bread is finished toasting and the veggies are almost finished sauteing. I went ahead and used a little bit of the vegetable stock instead of butter or oil. Then I'm gonna go ahead and add the minced garlic and the dried herbs and saute that up just a little bit more. And finally, it's time to bake. I went ahead and combined the bread and the sauteed veggies, added about 1.5 cups of vegetable stock to moisten it up. You can use more or less depending on your preference. Gonna stick this in the oven with foil on top for about 30 minutes. Stuffing is served. Whether you're a die-hard dressing fan or an avid supporter of stuffing, we can agree on one thing in the dressing versus stuffing debate. Both are delicious. We want to thank everyone at Scottsdale Arts for hosting us today, and thank you for joining us on your health. I'm your host, Erica Cardenas, wishing you a very happy and healthy day. See you next time.